Hi, my name is Misty Niemeyer. I'm the stranding coordinator for IFAW's Marine Mammal Rescue and Research Team. Here at IFAW, or the International Fund for Animal Welfare, we believe individual animals matter, and they matter in conservation. We work to rescue individual animals, conserve species, and protect their habitats where they call home, with the ultimate mission of creating a better future for animals, one where they can thrive and coexist alongside humans, us. Our teams work out of offices in 15 countries, but our work spans globally across 40 different countries. Our animal rescue programs work to rescue animals in crisis, from koalas in wildfires in Australia, elephant calves abandoned due to poaching, cats and dogs left behind in a hurricane, and dolphins, of course, stranded on the shores of Cape Cod, where our team calls home. Our Marine Mammal Rescue and Research Team is the agency authorized by the federal government to carry out stranding response here on Cape Cod in southeastern Massachusetts. The Cape, while a relatively small piece of land that juts out from the coastline, is surrounded by an incredible coastal ecosystem. And the surrounding waters are teeming with marine life, including shellfish, sharks, commercially valuable fish, several seal species, and over 15 species of cetaceans, which includes whales, dolphins, and porpoises. This abundance of marine life brings animals in, and combined with the geography of Cape Cod, it forms this hook shape of Cape Cod. And that, with the extreme tidal fluctuations and in some cases extreme weather, such as high winds, can cause a perfect storm of circumstances that have historically caused cetaceans to strand on our shores. Cape Cod is a hotspot for strandings of seals, whales, porpoises, and dolphins, and is particularly known for having the highest frequency of mass strandings of dolphins in the world. And that's when a group or pod of dolphins strands and is unable to get back to the water, putting them in extreme danger. Many people are really surprised that the Cape sees such a high rate of live stranded dolphins, but in fact 25% or a quarter of all the live dolphins in the US strand right here on our shores here on Cape Cod. The question we get asked the most is, why do they strand? And that's the million-dollar question. And one of the ways we work to answer this question is to conduct a necropsy, or a postmortem exam, which is the same as an animal autopsy, basically, on animals that either washed up on the shore dead or don't survive, unfortunately, a stranding event. Most of the dolphin species that commonly strand in this area are highly social, and they travel in groups or pods, and they often stick together and even strand together. These stranding events in this area in particular can be caused by either one distinct factor or a combination of factors. And in some cases, that can be really difficult to determine. Dolphins swim into these shallow areas, sometimes following food, and into Cape Cod Bay in that hook shape. And they often, then as they're trying to navigate, their sound is actually absorbed, we think due to the gently sloping shores and soft sediment, back, leading these animals to head up into small waterways, thinking there's a way out. And then a few hours later, the tide recedes, and anywhere from 9 to 12 feet, and they find themselves trapped. Storms can make this situation worse, but animals can also strand from other reasons, not frequently here on the Cape, but underwater noise from construction or from sonar can cause animals to strand. And then single-stranded animals are more likely known to strand from specific causes, such as illnesses or injuries, or illnesses caused by contaminants or disease, plastic ingestion, or trauma from vessel strikes or entanglements in fishing gear. And as you may have noticed, several of these causes are human-caused. And conducting necropsies allows us to monitor trends in the causes of strandings and death in these animals, which it can include emerging diseases and human impacts, which is one of the reasons why our team works so hard to not only rescue live dolphins and get them back out into the wild, but in cases where the animals do not survive, conducting these important exams allows us to find out what we may be able to do to either provide better care to these animals that strand or how to prevent strandings from happening. I have been with IFAW's Marine Mammal Rescue and Research Team for over 12 years now serving as the team's stranding coordinator. But for about 10 years, I served as the team's necropsy coordinator, focusing more on the necropsy events, planning, coordinating, carrying them out, and dealing with the data and the samples that are associated with that. However, our team, being relatively small, does everything. And now, serving as the team's stranding coordinator, I coordinate both live and dead animal events, including necropsies. I am been here on the Cape for over 16 years now, but I am not a Cape Cod native. They call it Washashore. I'm actually from California. I went to school and got my degree in biology at the Humboldt State University in Northern California. And I grew up in San Diego in California along the coast, which is probably has a lot to do with my my draw to the ocean and to the ocean environment and working in the field that I work in. From California, I spent some time working with on several different endangered species projects, working to conserve or do population studies on species such as the North Atlantic right whale, which I still to this day through this job also continue some of that work, as well as Hawaiian monk seals out on the northwestern Hawaiian Islands, working with that population, which is also impacted by many different which is also a population that has been struggling in recent years, and in many cases due to human impacts, very similar to some of the same work that I do here with our stranding team.
I'm Sarah Sharp. I'm the rescue veterinarian for IFAW's Marine Mammal Rescue and Research Program. I have been working with the team for about 5 years now, but I actually started as a stranding biologist in the field about 20 years ago and worked in the field for a number of years before deciding to go back to veterinary school to continue to improve what we could do for animals diagnostically, both pre and post mortem. So my job is to handle and manage the live animals during stranding. So we get a lot of live dolphins and porpoises that strand here on Cape Cod. And we also have a lot of seals, particularly entangled seals, that we will try to disentangle, capture and disentangle as well. So Cape Cod keeps us pretty busy, and there's lots of animals to tend to, but we also do necropsies on all of the animals that either die or are found very fresh dead. So we do about at least one a week or so throughout the course of the year, and we use that information to feed back into our clinical program to actually understand better why these animals are stranding, what illnesses they're suffering from, what sources of trauma are out there, and how we can better manage them when they strand alive.
My name is Nicole Hunter. I am the Assistant Necropsy Coordinator here at the International Fund for Animal Welfare. I first started with the team here at IFAW in 2014 as an intern. I completed 2 internships, and then actually that kind of rolled into a year-long apprenticeship position, which is pretty unique to our program here. And after completing that, I stayed on with IFAW here part-time, doing some kind of on-call work while I was working full-time at the New England Aquarium as a biologist, working primarily with sea turtles and stranded marine mammals as well. And then back in 2019, I came back here as part of the MMR team full-time again, and love being here.
Hi there, my name is Kira Casper. I'm a stranding biologist with the team at the International Fund for Animal Welfare. I started with the team back in 2013 when I was doing an internship. I did a necropsy internship, got pretty hooked into the marine mammal sciences, and from there I did 2 study abroad semesters focusing in the marine mammal sciences, one in Africa and one in Australia. Afterwards I came back and I interned with the New England Aquarium with the sea turtle husbandry experience. I also volunteered with the National Marine Life Center getting some sea turtle and pinniped experience, and then I did a right whale foresting ecology research cruise with NOAA for a summer as well. And then also interned back with IFAW back in 2017, after which I was able to get the necropsy apprenticeship, spending a year here to focus really all my efforts on necropsy skills and honing in on that. And then afterwards I became a permanent member of the team here and have been with the team ever since back in 2018. And while I'm doing my stranding biologist work, which I absolutely love here, I'm also working on my master's in wildlife forensic sciences and conservation on the side.
So we're just going to demonstrate a few clinical skills with this dolphin here. So we'll start with blood draw. So one of the locations that you can draw blood from is on the caudal peduncle. So on the ventral caudal peduncle is where we are here. And they're basically paired vessels that run right along here. And they terminate and branch into the fluke. So you can also draw blood from the fluke vessels, which I'll also show you in a second. But right now we're going to focus on this caudal peduncle vessel. So this is our general kind of setup in terms of how we draw blood in these animals when they're alive. So we'll have a 18 gauge and extension set, and that goes right back to our vacutainer holder and adapter. And so we usually just draw directly into the vacutainer tubes. It's not going to work quite as well on a deceased animal. But you're essentially, when you're putting your needle in with these animals, you can do it right at the base of the flukes. You can actually go even a little farther caudal, but we'll do bevel towards the heart and just off midline, and you basically insert pretty much perpendicular to the long axis of the animal, and you should be able to draw back or pop on your vacutainer tube and get blood. With this animal, you can use about a 1-inch needle, should be fine, 1.5-inch needle since there's a little bit larger. So as I said, those vessels go down and they branch into the flukes. And so you can see you can draw blood ventrally on the flukes. Usually in our stranded dolphins, we're drawing blood on the dorsal surface just because they're lying in sternal recumbency in our rescue trailers, and it's a lot easier to access. But you can also draw, and in Tursiops and bottlenose dolphins, the vessels are actually a little bit larger on the ventral surface. So you can draw there, and you can, if you run your thumb along, you can feel a little bit of a depression, which is essentially where that vessel lies. So you can also show that here from the ventral surface, where you feel it here. It's basically in the cranial 1/3 of that fluke, and you're going to insert this is a fairly superficial vessel, so you're going to insert your needle at about that angle, and you should be able to draw back and get blood, and see there's blood in that hub there. All right. So as I was mentioning, in our stranded dolphins, they're usually lying in sternal recumbency on foam pads in our rescue trailer. And so we most often will draw blood from the dorsal flukes. So you can see, possibly, as I run my thumb across it, there's a little bit of a depression there. The rest of this is just pretty fibrous collagen, kind of collagenous tissue. And you feel a little depression right where that vessel is. So again, you would take your cap off and you're going in at about that angle. And again, it's a pretty superficial vessel here, and we'll show you what that looks like when we start dissecting the animal down a little bit more, so you can see what that vasculature looks like. But essentially, that's the angle that you're going for, and you should be able to get blood that way. There are a couple other sites that you can get blood. There is a lateral caudal subcutaneous vessel here that with ultrasound guidance can actually be catheterized. And then you can also draw blood from the pectoral flippers. There are some vessels you can palpate for the radius and the ulna, and there's a little depression in between them. And you can also obtain blood that way. This is really useful in larger cetaceans. So when we've had stranded minke whales and humpback whales, this is a much more useful location to get blood from there as well. But in these smaller animals, it can be a little bit hard, and those vessels can be a little bit small. So the final blood draw place location that we'll show, you can actually almost see it in this deceased animal. You can see these vessels coming up the dorsal fin. The dorsal fin is a tough stick. It is pretty much a blind stick. I find in live animals that you almost never can see the vasculature pattern. That's kind of an artifact of the animal being dead. But you can, and honestly, it's hard to feel them as well. It's much more difficult than feeling the fluke vessels. But again, with these dorsal fin vessels, you're going to insert your needle about that, and then you can pull back and get your blood that way. Obviously works better in a live animal. So those are your main locations looking for blood draw in these guys, and we'll show you the anatomy a little bit better once we kind of cut down into those appendages. But the next thing that we can show you is tagging. So for every dolphin that strands, we attach that we can release back into the ocean. If we do a full health assessment and they look like they're healthy, we'll attach a tag. And so this is essentially a static tag. It has an ID number on it, but it doesn't transit to a satellite or anything. So for the majority of our animals, we'll just attach this ID tag. We usually do it in the distal portion, distal 1/3 of the dorsal fin, and that's for a couple of different reasons, but one is for ease of resighting at sea. When animals only come up a little bit out of the water, you can see this nice bright yellow tag pretty easily, so that helps with our resighting. So when we're tagging like this, we'll prep the dorsal fin on both sides. The tag is also sterilized as well. And then these tags are actually really great. They provide a biopsy sample as you're attaching the tag. So you get your genetic sample while you're putting your tag on. So, all right, so you attach it here, try to line it up, and it goes through a lot easier that time. And so then when you remove the tagging applicator, your little genetic sample is in a little vial. And so you've attached your tag. So we do also attach satellite tags to these animals for our purposes, for animals that are more borderline release candidates, and we do attach those satellite tags in the proximal third of the dorsal fin. All right, so let's do a quick incision and show you what some of those vessels look like. We kind of peel that back. You've got these central vessels here, and you do have some more superficial vessels, which are the ones that you can actually see on the outside. So it is, again, a little bit of a blind shot. Those vessels line up somewhat with the superficial vessels, but ideally, if you were trying to get blood, you'll go for those deeper vessels. You can also get blood from the superficial vessels, which is kind of your more shallow angle, but you're not going to be able to administer fluids necessarily from that kind of standpoint. And then we can also go down here and show the flukes as well. So, all right, so this is your distal fluke, this is the dorsal surface and the ventral surface. These are the vessels that you're aiming for. They do have these really superficial vessels, and just again, deeper to those are these other vessels. Now these vessels are all periarterial venous rete, which essentially means there are little tiny veins around a central artery, and that makes, when drawing blood, you have to interpret your blood gases and other parameters fairly carefully because it's going to be mixed arteriovenous blood. So essentially that's what you're aiming for with your needle when you're drawing blood on the fleas. Right, so one more clinical procedure to demonstrate is doing intramuscular injections in these animals. So they have this really big, powerful epaxial muscle group here that runs down along the side of the peduncle, and so we do use that as a site for intramuscular injections, whether it's medications or whatnot. So essentially to do that, you'll prep your site just like you would in any other animal, and you kind of, with these animals, if you have to have a long needle, depending on the size of the animal, you can kind of steady your hand on the side of the animal, similar as you would do with a horse, and then your injection straight in, and you always want to pull back again and then inject your medications and then pull your needle out. So obviously in a live animal, you have to be really careful that they're not going to move around, and you make sure you communicate with the people that are around you when you're about to do the injection. But generally they don't have a strong reaction to it. But you can essentially do it anywhere along here. Their kidneys pretty much sit right directly below the dorsal fin, and they're pretty much tucked up into that body wall there. So you're still safe even doing it there, but I usually do it the cranial or the caudal aspect of the dorsal fin.
So today we're going to be necropsying a short-beaked common dolphin that's stranded here in Falmouth, Massachusetts on Cape Cod. Falmouth is an area that we don't typically see a lot of stranded dolphins, and when we do, they're typically single-stranded animals. A lot of our mass-stranded animals occur in the bay of Cape Cod. So that area isn't super common for us to see strandings, but we do occasionally, several times a year, get animals that do strand down there. So we got a report pretty early in the morning that this animal was swimming in shallow water, kind of coming in and out, coming closer to shore and then swimming farther out. So we did dispatch a team out there to kind of assess. That animal did end up stranding shortly thereafter while our team was on scene. So they were able to provide some supportive care to that animal. And then we were in the process of extracting it. We extract animals when they strand and bring them to one of our mobile dolphin rescue clinics so that they can get a full health assessment, and we can do a good look over of those animals. Unfortunately, when we were in the process of extracting that animal, it did start to thrash and then did end up dying there. So we did just kind of continue the collection process for that carcass, and that's the animal that we are necropsying today. All right, so we can take a look at the teeth here. We can try to open the mouth a little bit. You can see here that the teeth are all conical shaped and are all pretty sharp and long in this animal. There are some worn and missing in the posterior left side here. Those teeth are primarily used for grasping prey. If we work our way caudally a bit, we can move to the dorsal fin here. You can see the dorsal fin does have some defects or some healed wound in the trailing edge here. As far as anatomy, so this area down here is the peduncle. So kind of this area is the powerhouse of the animal. So they use that up and down motion for swimming. And then down this end, the flukes here, you can also see similar to on the dorsal fin, there are some healed defects in the trailing edge of the fluke blades here. Other things that we can point out here, there are some barnacle species that are hanging out on the trailing edge there. We do see that here and there. Oftentimes that can be if an animal had been hanging out farther offshore. Other things you can kind of see from this angle here, if you kind of look down the animal kind of straight on, as you can get a general idea of the body condition. So for this animal here, if we kind of look straight on, this area under the dorsal fin here is a little bit flat instead of kind of convex or rounded out. So for that, we would say this animal is slightly thin. We'll also take a look at blubber thickness as well to kind of get an additional component to nutritional condition. So after we take a good look, there are a few other, coming back down here to the peduncle, both on either sides here, there are some fairly linear scars on either side of the peduncle there. They're all completely healed over. So not entirely sure what those, the cause of those, but we'll definitely would note and measure and record those. Let's see what else we have here. So kind of once we do a kind of full look over of the animal, we want to make sure that we do take photographs of all of those things that we just talked about. So in general, when we take photos, we'll take photos of all sides of the animal. So the left side, the right side, take a photo of the dorsum, the ventrum, and then want to take photos of any of those significant findings or wounds or lesions. And when we take photos, we want always make sure that we have a scale and a ID card in all of the photos so that we have that in all of those. And we also want to make sure that when we're taking photos of specific wounds and things like that, that we're taking photos first far away so that we can get a good idea where on the body those are, and then we want to make sure we zoom into those to get a closer up image as well. So once we take photos, we can move on to some measurements. So for animals that we necropsy, we take a standard set of measurements. We're not going to go through them all here today, but we'll go through kind of the main ones, which is straight length. So when you take straight length, we always do this on the side of the body. Generally we do this when the animal is in its sternal recumbency, and on the left side of the body. We generally do it on the left side for consistency. And so when you do that, we have the front of the measuring tape at the tip of the rostrum there, and then we'll pull this straight on the side of the animal, and you're measuring from the tip of the rostrum there to the fluke notch. So you want to try to keep your measuring tape as straight as possible. So this is about 229 centimeters. And then from here, we will hold that position in the front there up by the rostrum. And then what we do is we'll take various other measurements across the animal. So like they were showing, we'll do from the tip of the rostrum to the the beginning of the melon, and the center of the eye, center of the blowhole, and there's various others, the interior insertion of the pectoral flipper, interior insertion of the dorsal fin, etc. So we want to make sure that for consistency we're keeping hold of that position at the front of the measuring tape. And then we take some various other measurements, including dorsal fin height. We'll take some measurements of length and width of the pectoral flipper, width of the flukes, and also some girths as well. So we take girth, maximum girth, which you kind of have to pick a few spots and find your largest measurement there. Also take it at the interior insertion of the pectoral flippers, and then at the anus as well.
The other thing I would add in terms of an external exam, when we're looking at all of our animals, we always examine them for evidence of human interaction. So things that we're looking for are potential trauma from a vessel strike or interactions with fishing gear. And so some of the key parts of the animal that you want to look at anatomically are in the mouth for any evidence of line. And with line, you want to think about how that line or that net might interact with an animal. So it's obvious it's going to wrap around an animal. And those parts that stick out from the body, so pectoral flippers, dorsal fin, and the flukes are oftentimes the areas of the body where we see those marks or those lesions from the interactions with the fishing gear most commonly. So I think that's part of your kind of a whole external exam, but those are some of the kind of features that you focus on for that part of the examination.
So we've just moved the animal onto its right lateral side, so we're taking a good look at the ventrum as well. So there just is some superficial skin sloughing, which we often see post-mortem. The main thing here, so I said earlier that this is an adult male. So we take a look at the ventrum here. So this is the anus here and the genital slit here. So in males, the distance between those two is a bit further apart than in females. Females would also have on the side of the genital slit two smaller mammary slits. But we don't use that as kind of a foolproof method, as males can occasionally have mammary slits as well. So the main way when we're sexing our animals is that we'll actually probe the genital slit. So if you probe in, it angles cranially or forward, that's a female, so you've entered into the vagina. And if it angles caudally or backwards, then that animal is a male, and you've entered into the penile opening.
So the next thing we'll do before we dive into the necropsy is take blubber thickness measurements. And so we do that by incising into the blubber and skin. And we do that at the level of the axilla. And we take blubber measurements at 3 different sites. So we take them dorsally, laterally, and ventrally. And when you're taking the blubber thickness measurement, you're taking it without the dermis or the epidermis. So it is just that layer of blubber in between the muscle and the dermis proper. So ventrally here, you can insert, as long as this is essentially zeroed at your 0 centimeters, you insert the measuring tape and you can see that the ventral measurement is 1.3. And then dorsally will be a little bit of a stretch. Usually we do this from the other side. But that measurement is 1.8. And so once our blubber thickness measurements are done, then we'll start essentially flensing the carcass. So we remove all of the blubber and skin in various segments so that we can reflect it back and access the muscle and then get into the thoracic and abdominal cavities. So while we're working on this, we can talk a little bit more about the blubber layer itself. So in cetaceans, the blubber layer is essentially your panniculus adiposus, or essentially your kind of fat. It is part of the dermis itself. We also call it the hypodermis. And it's a layer that's full of adipocytes, so those are the fat cells, as well as collagen and elastic tissue, elastic fibers. So we do use it as a measure of body condition, but the blubber layer itself can actually retain a lot of its thickness even if the adipocytes are gone, because of that collagen structure and the elastic tissue there as well. So it is a metric that we use, but it's not 100% foolproof. And the blubber itself can actually varies in its composition depending on where it is in the animal as well. So these animals have, deep to the blubber layer, they have a subdermal fascia. And so that's basically a connective tissue layer between the muscle and the blubber. And that connective tissue layer actually has some interesting functions where it actually helps improve the mechanics of their swimming and lower the energetic investment of the animal, because it essentially acts like a kind of a spring, essentially enveloping the muscles and harnessing that energy a little bit more. So you can see her just flensing back. So oftentimes if you kind of hit your sweet spot, you hit a nice little area of fascia that just separates really nicely from the blubber from the muscle. This guy isn't quite. That for sampling. So this is one of the lymph nodes that does drain a fair amount of the kind of cranial portion of the animal. So it's useful for sampling. Let's see. So when you're dealing with lymph nodes, you want to incise them as well. And take a look at the cut surface. So this lymph node is kind of mottled dark maroon to kind of a gray. It's very bloody on cut surface and wet, very dark throughout. All right, and we'll pass that off to sampling team. And their scapula of different species are kind of differently shaped. So we'll follow this around. And you kind of can just provide a little bit of tension and start dissecting around the underside of it. And you can see that nice fascia again there as well. So before I remove it completely, I do want to take a peek at the shoulder joint as well. So you can kind of move your flipper and palpate for your shoulder joint. I'll cut down a little bit more. You can take a peek at that before we take the flipper off. So you can kind of see and feel that movement there. Cutting through the joint capsule. And reflect it back. All right, so you can see in this animal that there's actually a bit of clotted blood within the joint capsule there, as well as a reddened surface of the humeral head and of the glenoid cavity of the scapula as well. So we do, again, often see this in kind of our live stranded dolphins where there's kind of hemorrhage into the joint cavities. Interesting. Let me see if we want to grab a photo of that, we can, or I can take the flipper off, whatever's easier. All right, so we've gotten some images of that, and then we can essentially just take the flipper off so that we can access the ribs. So to access the ribs, we'll just lens down a little bit more. Interesting stuff again.
We went ahead and cleansed the blubber here. You can see down in the caudal blubber here, we have found quite a few parasites here. So these are Phyllobothrium species. We see these quite frequently in our dolphins, most often in the caudal blubber here. So that's a fairly common finding for these guys. And then we also went ahead and removed on the left side here, this large group of apaxial muscles, which Sarah mentioned earlier. So we took that all out here, so you can see it's lying here. So you can see how large of a muscle mass this is. And then we went ahead and just thread sliced and cut through every few inches. So what we're doing is looking for any color change or lesions. Occasionally in our specifically live stranded animals, we'll see some pale lesions throughout the muscle that we're looking for. I didn't see any in this animal, but we always go through and check that out.
So the apaxial muscles lie between the transverse processes of the vertebra and the spinous or the dorsal processes. And so those are both elongated in these species to again help with the kind of mechanical lever action of these big muscles that help them propel them and swim. And so the apaxial muscles lie here, and those are the upstroke muscles, and then the hypaxial muscles lie just below. This is the transverse process here, covered in a little bit of muscle. And the hypaxial muscles are here, and those are the downstroke muscles. So both muscle groups are really important for swimming in these animals. And so we've also flensed down up here to kind of access the ribs. So the rib cage in marine mammals, or in cetaceans at least, a little more flexible than other species of mammals, and that's again another diving adaptation. The most cranial ribs are what we call double-headed ribs, so they have essentially two attachments to the vertebra, so they're a little bit harder to disarticulate. When you're preserving a skeleton for museum preparation, you actually want to disarticulate every rib as you go. This animal's skeleton will not be saved, so we don't necessarily need to do that, but we can kind of demonstrate how to do that. So when you get your carcass to kind of this state, the first thing you want to do is to try to essentially access the abdominal cavity, so you'll feel for the last rib. These guys actually will have oftentimes some floating ribs that you can feel they're not actually attached to the vertebra. But you can access back here into the abdominal cavity, and you can actually incise into the peritoneum. And so you can see this is essentially their muscles that you're cutting away here to access that. And what you can actually do from the abdominal cavity is pierce the diaphragm to check for a pneumothorax. So you're looking for essentially abnormal air in the thoracic cavity, and you can do that because the thoracic cavity should be negative pressure. And so as you incise it, it should essentially suck air in to the thoracic cavity. And essentially that chest may inflate a little bit. If there's a pneumothorax, the chest may actually deflate when you incise into it. So we'll continue kind of flensing down. We can show you this articulation of the ribs. So you can kind of palpate. Dolphins have bony, you can call them costal cartilages, or you can call them sternal ribs. They're more bony and less cartilaginous than other species. But you can essentially palpate for the articulation and kind of cut accordingly. So oftentimes I'll start kind of at the caudal ribs and move more cranial. Gives you a little more leverage when you start getting into those tricky double-headed ribs. The more caudal ribs are single-headed ribs. So they're a little easier to disarticulate. And you can kind of cut down in between them too, but oftentimes if you get a good angle with cutting one rib, it follows in line, the articulation follows in line with the other ones. You do have to cut your intercostals as you go. So we're getting into the portion of the double-headed ribs. So you kind of approach those by cutting that capitulum, and then you angle your scalpel down along, kind of deep to that. You should be able to incise that second articulation there. Never put your fingers down in there, it doesn't go well. These older animals, it can be a little bit harder to disarticulate the ribs. There we go. So you can see essentially your double articulation here and here. So this animal had it on the five most cranial ribs. So that's your rib cage, as I mentioned, a little more flexible than in most terrestrial mammals. You can palpate the ribs, feel for any fractures. Sometimes you'll feel like healed fractures, old healed injuries. But in this animal, these are all palpating completely normally. Okay, so once you get that off, you can kind of look at your diaphragm itself as well. Some areas of discoloration here on the abdominal diaphragm, abdominal surface of the diaphragm, but otherwise looks pretty normal. So we can kind of do a quick tour of our body cavities here. So we've opened up both the thoracic and the abdominal cavities. And you can see the lungs here. So this is the left lung, left side of the animal, left lung. And you can see that this kind of cranial aspect of the left lung overlies the heart. And this is actually really thin pulmonary tissue. It's completely normal, it's just all part of the anatomy. And then what you can see too is when I reflect that back, you can see the pericardium, which is the sac that the heart sits within. You can see the aortic arch here. The pericardial sac is normally kind of this color, slightly translucent, and you can kind of look for any fluid in there once you incise it. You can also look for only have a left and a right lobe, as opposed to many of your other mammalian species. And then on the left side, when we open the animal, we're going to appreciate primarily, so this is the main stomach. So dolphins have 3 chambered stomachs generally. Some other species of beaked whales and things have other numbers of chambers of stomachs, but for most dolphin species, we're dealing with 3 chambered stomach. So the food travels down the esophagus and into the forestomach here, which is essentially an outpouching of the esophagus. The lining looks pretty similar, the mucosa looks pretty similar. And then this is your glandular stomach or your fundic stomach, and this is actually what produces the enzymes for digestion. And so those are retroflexed back into the forestomach, which is where all your fish come into. So this forestomach is really distensible, it'll expand when an animal eats a lot of fish at one time. And then the main stomach does the job of producing those enzymes and hydrochloric acid to help with digestion. And then you can see tucked under here on the forestomach is the spleen. So dolphins generally have a globoid spleen, and oftentimes they'll actually have a little accessory spleen or spinunculus, as they like to be called. There can be any number of them. We've seen quite a few in some species of cetaceans. We'll reflect that back down. You can also see tucked in here, the pancreas is kind of lying, a little bit hard to see, but in and among the duodenal ampulla. So we'll talk about once we get the GI tract out. Then you see the rest of the kind of intestines. It's really hard to tell ileum for jejunum in the small intestines, and they do not have a cecum, so you cannot necessarily see exactly where that small intestine turns into large intestine. But you see that kind of running back here. Next we'll talk about the kidneys. So the kidneys essentially, like I mentioned before, lie up and against the body wall. And so when the dorsal fin was here, the dorsal fin was approximately around there. And so the kidneys are basically ventral to that. Cranial to the kidneys, you can also look for the adrenal glands, which we'll have to cut down a little bit more to see, but you can see the adrenal glands. Cranial to the kidneys on both sides. And usually I don't remove my kidneys until I've found the adrenal glands because they're a good landmark. So this is an adult male, as we mentioned, and marine mammals, males in particular, have essentially internal reproductive organs. So their testes are actually within their abdominal cavity. And in order to manage that from a temperature standpoint, since the testes like to be cool, dolphins have evolved to have these really amazing countercurrent heat exchangers, so essentially massive vascular plexus that essentially brings cool blood to the testes. So these are the 2 testes, the left and the right, that you can see here. Urinary bladder is sitting on the ventral, essentially ventral body wall, and this is contracted in this animal. So in a female, you would see basically dorsal to the urinary bladder, you would see your vagina, cervix, and then it's a bicornuate uterus, meaning it has 2 horns that go up to your ovaries, which sit essentially just caudal to your kidneys. So what we're doing now is kind of incising up along the ventral aspect of the head and essentially grabbing the tongue. And so oftentimes, and you can do dissections lots of different ways, but what we oftentimes do is essentially take out the entire pluck. So the pluck is essentially the tongue and then the entire respiratory tract. So the trachea, the lungs, as well as the heart and the esophagus oftentimes comes with it as well. So we'll do that as just kind of a method to visualize these structures. So while we're here, we have, the dolphins have kind of an interesting respiratory anatomy. Their larynx is essentially modified into what we call the goose beak. So the epiglottis and the arytenoid cartilages are actually elongated and actually stick up into the nasal passages or the narial passages of the dolphin, which in this animal, the blowhole is here at the top. It's a single blowhole, but once you get down into the skull, it actually divides into two separate nasal passages. And so this goose beak actually sits up inside there, and I'll kind of dissect it out a little bit more, but this is their larynx. So this is their an adaptation to how they are breathing. And so you can see normally it actually sits up inside, almost vertically into those nasal passages. And if you're intubating a dolphin, you actually have to reach your hand inside their mouth, grab that epiglottis, the goose beak, separate out the cartilages with your fingers and actually intubate through that, essentially orally, through the goose beak or through the larynx there. So you can see how it essentially sits normally up in the nasal passages, and around it the esophagus sits. And so when they swallow fish, the fish can actually go around either side of that larynx, and it's not blocked at all. So we'll continue some more dissections, show you more in a minute. And so in order to support that massive larynx and its movement, dolphins actually have a really well-developed hyoid apparatus, which are the bones here, and that controls the movement of the larynx up and into the narial passages, and they can also disarticulate that as well on their own. So when you're dissecting in general, but especially kind of trying to take the pluck out, you'd want to try to minimize the actual damage to the tissue. So you're cutting that connective tissue that's holding them all together, so you can take them all out in one piece. There are obviously a lot of vessels here, so you're kind of inevitably going to incise into vessels. Not much you can do about that. And actually, within the thoracic cavity, you can see a couple different places here. Dolphins, again, have another kind of diving adaptation. They have this kind of plexus of vessels that sit along the thoracic wall. And you can see essentially some as well down in here. And it's a plexus of vessels that's called the thoracic reedy or the reedy mirabula, so miraculous reedy network of vessels. And that can help, again, it's another countercurrent heat exchanger that's thought to potentially have a number of different uses, whether it's cooling the blood going to the brain, potentially forming a bubble barrier for bubbles that might form during diving, like nitrogen bubbles in the blood, and forming is essentially a filter for those. There's also the thought that it may store extra blood during the dives and may provide kind of a blood pressure dampening effect for blood going to the brain. So we don't know necessarily essentially exactly what it's for, but lots of potential really interesting uses of that thoracic reedy. All right.
We've gone ahead and pulled out a few organs from the abdominal cavity. These are all things that Sarah pointed out in the tour earlier, but what we're going to do now is kind of go through each organ individually and take a look. So we can start up here. So these are the adrenal glands that, as Sarah mentioned, sit just cranial to the kidneys. So we made sure to pull those out prior to the kidneys since those serve as good landmarks. So we can go ahead, just in kind of a quick look there. I'm not seeing any lesions or anything on the capsule or serosa. So we can go ahead and just red slice into those. We can take a look at the cut surface of both of those. You can see it might be a little bit hard to see, but you can see there's a pretty well-defined cortex and medulla on the cut surface. And then there is a bit of a thin dark band at the corticomedullary junction, which are all things that we often will just record. But other than that, I don't see any specific lesions or anything else abnormal with those. Then moving on, so we took out the left and right kidney here. So we'll go ahead again, looking at the capsule here. I'm not seeing any significant lesions, but we'll go through and open those up. So with the kidneys, we're looking for things, anything like parasites or stones or any other lesion, Can also check the major ducts as well for stones. So now that I've got this open, you can see here, I'm not seeing anything abnormal with the kidneys here. So you can see all the individual raniculi are kind of loosely adhered, some are kind of falling off here. So we're looking also then on the cut surface of the individual raniculi themselves. Again, the cortex, you can kind of see the of each raniculi, the cortex is slightly darker than the medulla. But again, I'm not seeing anything super abnormal there. Then moving on, this is the urinary bladder here that I pulled out. When it was still in the animal, it was still pretty contracted. Didn't, just with palpating, didn't feel any urine. And when I excised that, just a very scant amount of yellow urine came out. But we can go ahead and open that up. Then it's pretty much empty there. I'm not seeing any bruising or discoloration or anything, which we can occasionally see with some of our live stranded animals. But overall, that looks pretty normal. And then lastly here on the board is the spleen. And again, as Sarah pointed out, the little accessory spleen, which came along as well. So we'll go ahead and cut into it. So oftentimes, the serosa does kind of get this kind of mottled, speckled appearance. The cut surface is generally homogeneously maroon, like this. Pretty normal.
Alright, so what we have here is the excised pluck that I mentioned before. So this goes from the tongue, takes out the trachea, entire respiratory tract, as well as the heart and the esophagus. So as I was mentioning before, you can see this is the esophagus I'm holding here that I retracted from its natural kind of posture. And so you can see that the esophagus, essentially, as I mentioned before, the food will go on either side of that larynx and down into the esophagus. And you can get a little bit better look at this goose beak. We do inspect the goose beak cartilages for any evidence of kind of trauma. Sometimes in our live strandings we can see red discoloration to the cartilages. This is all just kind of blood contamination, otherwise it looks good. And you can also see evidence of hooks if dolphins swallow fish with hooks in them. the hooks can actually get lodged in this structure as well, so it's always good to examine it thoroughly. One of the other kind of unique adaptations to marine life is dolphins. Young dolphins will have what are called marginal papillae, so they'll have these little basically finger-like projections off of the anterior portion of their tongue and the lateral portion of the tongue, and when they're young and nursing, that helps kind of establish a suction so that they can get the milk from their mother. But as they get older, they regress, and so in this animal, they're not really even barely visible at all. But you can see no ulcerations or any other abnormalities on the surface of the tongue. We examine the caudal pharynx, and you can actually look for tonsils in these animals as well, and look for inflammation there. And then we'll show you, so this is essentially the trachea coming down here, and we flip it over, and ventrally you'll see this is the thyroid. So part of it has already been incised here, or excised here. This is the thyroid gland in dolphins. It can be pretty variable in terms of its shape, but in this animal it was pretty bilobed around that ventral portion of the trachea. So if I reflect back that esophagus, the next thing that you can see here, so this is your trachea coming down, and these animals actually have a tracheal bronchus or an accessory bronchus. And so you can see this is the main tracheal bifurcation going into the right lung and into the left lung. But on the right lung, they actually have what branches off prior to that tracheal bifurcation, that tracheal bronchus. And so that leads into the cranial right lung. So if you're concerned that an animal is aspirated, I oftentimes will ultrasound that cranial right lung to look for evidence there. It's essentially one of the first places that anything that the animal breathes into their trachea will end up in terms of in the lung anatomy. Otherwise, you can just follow the regular tracheal bifurcation into each of the lungs. And you can see here, we'll kind of do a quick examination on externally on our lung surface. The right lung here is quite spongy. It's essentially pink in color without the blood contamination. And it's fairly soft. So I will palpate that for any nodules, any firm areas, and we'll cut down into it and do our bread slices to examine that more fully. You can also see again that marginal lymph node is down here on that right side. We didn't look at that prior to. We'll examine that as well. And then you'll see the aorta coming off here, and our left lung that we looked at in situ with that really thin cranial aspect to that left lung lobe. And you'll note in cetaceans, they have just one single lung lobe on each side, so there's no division of the lobes. It's just a right lung and a left lung with no lobes. All right, so we'll continue kind of cutting down. What I oftentimes will do is incise down into my trachea. And so they also have a vascular plexus along the mucosa or submucosa of the trachea as well. And you can see kind of sometimes that's fairly congested, as you can see in this animal here, the dark surface, but it looks smooth. I don't see any other abnormalities there. So oftentimes we'll just follow the airways down. Live stranded dolphins can oftentimes have froth or foam in their airways, as can bicaught animals. So always good to look. And then we oftentimes will see lungworm in our cetaceans as well. So looking for any sort of worm burdens as you go. And in fact, you see a little nematode peeking out from one of the bronchi here. You can see. So we can take a closer peek. I'm sure there will be more of them as we go. You can also see here there's a little firm nodule, and oftentimes from lungworm infections. So as we go, we can examine the pulmonary parenchyma, or the cut surface of the lung, and you can see kind of mottled maroon, again fairly spongy. Just found that one firm nodule so far. So there was just a single white nematode, Misty, in one of the bronchioles. We'll look for more. The left lung has kind of some darker, more maroon fluid in the distal airways. Don't really appreciate a little bit in the left or in the right as well. And then kind of for general descriptions, the left lung here was a little bit darker than the right lung. We had mentioned the right lung was kind of mostly bubblegum pink with a few depressed areas that are slightly darker maroon in color. And then the left lung is a little bit darker, kind of red in color with, again, multifocal depressed maroon areas on the pleural surface. So after we followed the airways down, we'll do kind of a bread slicing on the lung to look again for more parasites. These animals can have lungworm both in the airways and the passages, as well as in the more distal lung parenchyma as well. So you kind of scrape and see if you can find any of those. On the left lung, I'm not feeling any, these really don't palpate. Oh, this one might. There's one that palpates a little firm. Just a consolidated area of lung tissues and a really well-defined nodule. And then the parenchyma of the left lung is dark maroon. It is also spongy. And no other visible. Basically another single nematode in the bronchioles of the left lung. All right, and then when we take samples from the lung, we tend to take a sample that's close, kind of in the medial lung near all of the airways and the bifurcation, and then we can take a little bit more distal lung sample as well. So all in all, the lungs actually don't look that terrible on this animal. So we also have here the tracheobronchial lymph nodes. So they're kind of right at the tracheobronchial bifurcation. You can see them bilaterally here and here. So these are another pulmonary lymph node that we do like to use for sampling and testing diagnostic purposes. So they can essentially be excised. And then we'll take a look at the cut surface. So these lymph nodes feel pretty firm. And then the cut surface is essentially mottled a little bit of black in there, but more or less kind of white. Lymph nodes can have variable amounts of kind of fibrous tissue as animals age too. But pretty firm and fairly normal otherwise. Take a look at so that was the right. Take a look at the left as well. So this is the marginal lymph node that we talked about earlier. Kind of excise it with a piece of lung. So these can actually be measured on ultrasound in animals and used as an indication of potential thoracic disease. So normals have been established for bottlenose dolphins, but not other species of cetaceans. So insights into that looks kind of dark maroon. It is also firm, not wet or gelatinous on cut surface, but maroon medulla or center, and then kind of tan cortices. So that's the right, and let's look at our left. And the left looks pretty much the same. These do tend to be pretty triangular in shape, or pyramidal, I suppose. Again, that same kind of dark maroon, medulla, tanner cortex, firm texture. Dolphin hearts are kind of dorsal-ventrally compressed and kind of globoid in shape as well. So as it would sit in the body, you have your left heart here, your right heart here, and you can see your aorta coming up and tracing back through the thorax caudally. So this is the pericardial sac that we mentioned earlier, which is the sac in which the heart sits. So you can look inside the pericardial sac for fluid, and honestly every cavity. So we look in the thoracic cavity for fluid and the abdominal cavity for fluid as well. When we open up our animal initially, you can see some clotted blood coming out of the heart chambers there. And then there's a number of different ways you can dissect a heart, but I often will do kind of essentially a book cut around the apex of the heart. You can look for epicardial fat as well, which this animal really does not have an appreciable layer of. And so we'll open up the ventricles this way. So this is the inside of two of the chambers of the heart. So this is the left heart here, and you can see the mitral valve that goes between the left ventricle and the left atrium here. So we'll examine the valve leaflets for any abnormal nodular appearance, but these valves don't feel thickened. I don't see any nodules. That all looks pretty normal. And then we'll look here at the right heart and the tricuspid valve. Aside from some blood in there, those valves all look normal. All right, and then we oftentimes will take a measurement about halfway up of each of the chambers in the septum. So the left ventricle is 1.5 centimeters. The septum is 2.5, and the right ventricle is 0.8 centimeters. So otherwise, we're looking at the myocardium. That all looks pretty much maroon and homogeneous throughout for the left, the right ventricle, and the septum. Maybe a little bit of fat here at our apex. A little bit hemorrhagic there. All right. And then, do you need the measurements again?
Yes.
Okay. So the left wall is 1.5, septum 2.4, and 0.8 on the right. I will say that the right atrium does look a little bit flaccid and distended. Not distended, but flaccid and enlarged. So we'll incise up here. Take a look. No clotted blood or anything. Just remnants. Take a look here. Another pulmonic valve. So all these leaflets look thin, smooth, and normal. Going from the right ventricle into the lungs. All right, and now let's look at the left side. Open up the left atrium, auricle. That all looks normal. We'll follow the blood flow from the left ventricle up into the aorta. Take a look there. So that's the aortic valve. You can see there. Right, so we have the liver here taken out. So just quick look. So this is the parietal surface here. So it's mostly a dark maroon color. There are some paler red areas kind of on the medial aspect. On palpation, don't feel any nodules within the parenchyma. There is, however, kind of the distal aspect of this lobe, there is a super tiny red firm nodule there, possibly an older parasitic nodule, but we can sample that for histology. So that's all I'm seeing for externally, but then we'll go ahead and just make some bread slices into the parenchyma. Looking for any lesions, parasites, color change, and such. So it looks like everything I'm seeing is pretty much just homogeneously maroon. It looks quite normal. Like I said, nothing abnormal there, but we'll go ahead and we'll take a few samples. We'll sample this little nodule down here. We'll take kind of a more deeper piece as well. Maybe I'll just look in here. Okay, so this here is kind of our entire gastrointestinal tract and essentially taken out together. So the anatomy of this, you can see some things a little bit better than you could in situ because you can get kind of both aspects of it. So this is that fourth stomach that I talked about before. That's the outpouching of the esophagus, really distensible, very muscular. This is our main stomach, or our second chamber of the stomach, and this is the actual digestive, where the digestive enzymes and hydrochloric acid are produced. And then you can see this is where the esophagus came down and entered the forestomach. And then on this side we actually have our U-shaped pyloric stomach chamber. And so that's the third chamber of the stomach. And then that terminates in a pretty strong pyloric sphincter, which regulates the flow of digestate into the intestinal tract. And then you can see this kind of unique structure, which is called the duodenal ampulla. And so that's kind of the cranial-most aspect of the small intestines and cetaceans. It's essentially a dilated kind of portion of the duodenum as well. And then the other, like I mentioned previously, associated with that duodenal ampulla is part of the pancreas here, the limb of the pancreas that you can see pretty well. And then as we kind of go down our small intestines, you can see at the root of the mesentery, there's actually a pretty substantial sized lymph node called the mesenteric lymph node. And so that is oftentimes in these species kind of an elongated, sometimes not nodule based, but mostly kind of a cigar-shaped singular lymph node placed at the base of the mesentery. So as you look throughout, you can see, kind of take a look at the mesentery, and that looks nice and translucent. That all looks pretty normal. Sometimes we can see kind of parasites attached to the mesentery as well as to the kind of abdominal wall of the peritoneum there. You can see that the mesenteric vessels are kind of filled with blood. There are occasional bubbles in here which are most likely caused by our incising it and introducing these air bubbles. So what we'll do is we'll kind of take the stomachs off and take a peek at them separately. And then we'll go through, and usually you can run your entire intestines, or what we do more frequently is essentially spot check them. So you can see my pancreas here, so I'm going to kind of snip all this out as well as kind of a portion of the cranial most intestines here. Take my pancreas with me. And then do you want to maybe spot check those guys? So here you can see it kind of even better. How it generally sits in the body. Forestomach, main stomach, pyloric stomach, which is this kind of U-shaped third chamber. All right, so we'll follow the flow of the food down the esophagus, into the forestomach, see very muscular. You can look for contents in here. Oftentimes these animals will have a nematode burden in the stomach, and they can have associated gastric ulcers. But in a fair number, it's actually pretty clean. The mucosa is white, just a small amount of brown, opaque fluid present within the forestomach. So some more good anatomy. So you come down the esophagus, and then your main stomach actually opens off to the side. So we'll look down in there. And so you'll notice a massive difference between the mucosa of the first or forestomach and the second or main stomach here as we open them up. So again, this is the digestive powerhouse of the stomach. There are a few encysted parasites there. As well, we can grab a photo of them. Have a nice clean one. And then we'll go back into our third chamber, the pyloric. And into the pyloric. So the pyloric stomach, you can see, is spilling out some tan fluid. Probably about 20 cc's of that. And so we oftentimes do see a little bit of kind of petechial hemorrhaging on the mucosal surface of the pylorus. And there's also about a 1 centimeter kind of raised off-white to yellow plaque towards the aboral poultry shears are really wonderful for cutting intestines and tissues with a lot of elasticity in them. Onto our duodenal ampulla. A little bit kind of maroon discoloration to that. Down here. So just kind of some pasty white contents, but not much else. So duodenal ampulla. You can take a quick photo of that. All right. And then we've got a little section of our pancreas here that we can incise. Pancreas is usually kind of a bubblegummy pink, and this is basically that. Thanks. We do oftentimes see patchy, darkened areas within the pancreas. This is potentially hemorrhage caused by black-stranded animals. So you can see some of that here. For the pancreas, you can see the bile staining around the ducts. And a little bit of kind of dark maroon patchiness to that mostly bubblegum surface. The pancreas is always a bit soft, and that's all kind of normal, and it does decompose pretty rapidly. So we'll take some samples of that as well. All right. So I think that's it for the stomach chambers and the pancreas. And
so the intestines just had, they were mostly empty. There was alternating kind of pockets of opaque tan to yellow fluid, no parasites.
okay, so we've got our excised testes here. You can see kind of, so with dolphins, they have a lot of species have a well-defined seasonal breeding period, and so these animals are able to actually have a marked difference in the size of their testes based on what season it is. And so these are definitely adult testes of a reproductively mature male, but they can actually get to almost twice or three times the size. So you can see the epididymis here as well attached, and so we generally, and you can see a little bit of maybe a slight amount of perivascular hemorrhage here on the tunica and those vessels as well. So as I mentioned before, massive countercurrent heat exchangers in order to keep these intra-abdominal testes at a temperature where they can be functional. And so we'll just essentially bread slice these again. So brucella is a common finding in cetaceans, and orchitis associated with that, or inflammation of the testes. It has been found in both our wild delphinids as well as animals under managed care. And so we're just and the right is looking the same, so just gray. So some prominent vasculature, and the right has some possible perivascular hemorrhage on the tunica or the capsule. But no major abnormalities, again, kind of smooth in their texture. And on ultrasound, you can actually see this structure that runs down kind of the center of the testes as kind of a bright white reflection on there. It does actually have a monorhigma, so this is another encysted parasite. So this is the cut surface of that mesenteric lymph node, so that drains the GI tract, and there is just a little focal area of dark maroon. Palpate's a little bit firm, kind of compared to the rest of it, but otherwise that fairly normal looking mesenteric lymph node. So the next thing we're going to do is essentially take the head off or decapitate the animal. So you find that atlanto-occipital joint, or the joint between the skull and the first cervical vertebra. And essentially just incise down. Obviously you have to cut off all the soft tissue as well. Too messed up with blood. Essentially the back of the skull, and this is the C1 vertebra, the first vertebra, cervical vertebra. So you can see the spinal cord in the canal, and it's surrounded by this epidural or spinal reedy. So again, it's another arterial venous plexus that again functions as a countercurrent heat exchanger. And all those other kind of potential mechanisms that I mentioned earlier. And then here, and you can see that plexus quite well, and the spinal cord as it enters the foramen magnum into the skull, into the brain. All right, so I'm going to sample a little bit of spinal cord, so you can kind of grab the tissue around it. Try not to crush your spinal cord while you're grabbing your sample. Don't see any abnormalities there either. And you can also examine kind of the articular surface of the C1 and occipital condyles. Everything looks normal, smooth. This animal did thrash a bit. You can see a little bit kind of maroon discoloration to this dorsal muscle here that overlies the skull. But next, essentially, we're going to remove all of the soft tissues from kind of around the skull so we can get down to it and use our bone saw to get into the skull and remove the brain for further sampling and examination. And then behind me, Nicole is essentially breaking down the carcass, so kind of disarticulating between the vertebra and breaking it down so that it can be disposed of there as well. So we do flip over the carcass at the end of the necropsy to kind of do the same examination of the apaxial and hypaxial muscles that we did on the other side. We can look for any lesions or any parasites there as well as examine the right ribs as well. So what we've done at this point now is to disarticulate the mandibles from the skull. And so you can kind of do this by incising, opening the mouth and incising back, and kind of basically opening the mouth as you go. And there's a little bit of blunt dissection as well. And so what you can see, hopefully, in here is this is the intramandibular fat pad. So it's a pad of fat on either side of, inside the mandibles on each side. And that essentially leads right to where the inner ear is, which you can see here at the base of the skull. So dolphins actually receive sound information. So they echolocate out their melon, which we can talk about in a second, and then they receive the sound information, we believe, through their lower jaw and through these fat pads or acoustic fats that help transmit the sound waves directly to the ear itself. Before I flip the skull over to show you the melon, which they use to echolocate, we did incise into what are called the pterygoid sinuses. So these dolphins have basically a series of air sinuses within their skull that have pretty, again, vascular plexuses that are pretty pronounced that help kind of engorge and help manage the regulation of air as the animal dives and regulate the pressure in there. But these sinuses oftentimes in our stranded dolphins will actually can become infected. And when you're examining inside the mouth of a live dolphin, you can actually open their mouth, and sometimes you can see, just in the caudal oral pharynx, you can see some swellings there. And that's kind of the area of the pterygoid sinuses basically just cranial to the eye and the back of the mouth in the part of the skull. So they're just air sinuses, air spaces within the skull that can have what we oftentimes find are little nematodes that are present within the sinuses. And this guy in particular had some pretty gray, opaque fluid that came pouring out of both the left and the right sinuses. You can kind of see the remnants of it on either side here. It's a little bit blood tinged now, but it was pretty gray, viscous fluid from either side of the pterygoid sinuses. So that's a significant finding, and we'll see if we find more in the brain. And we did actually find a tiny little nematode in there as well. All right, so flipping the dolphin head over, dolphins are obviously really well known for their echolocation and their ability to echolocate, and part of that is the melon, essentially. And so what the melon is, it's just a fatty structure on the front of the skull that essentially acts as a focal lens. Dolphins are able to produce sounds using air essentially around their blowhole, and then this melon focuses and transmits those sounds so that they can actually see with these sound waves. Anyway, so this is essentially what the melon looks like when you remove a little bit of chunk. So it's really just fatty tissue at the cranial portion of the skull, just in front of the rostrum. And in porpoises, they don't have a rostrum that necessarily extends out that far. This is kind of extension of the maxillary and premaxillary bones in these animals to make a rostrum. But in porpoises, their head kind of ends here as well. But in the dolphin, you'll get the extension of the rostrum. So this is where the melon sits, really important for echolocation in these guys. So I did search in the pterygoid sinuses a little bit more, and we did find a few of the parasites that were in there, little worms, inside that kind of gray fluid inside the pterygoid sinuses. Then we did move on, and we extracted the ears. So this one's left a little bit more in situ. We kind of cracked it open to look inside. And you can see there's a tissue in here that's called the corpus cavernosum, kind of similar to what's found in some of the penises of certain animals. It's basically, again, just kind of another vascular plexus that can become engorged with blood during dives to regulate this, again, this air space around the inner ear to help regulate that. All right, so ear bones, again, sitting down in, and you can kind of remove the whole complex itself. You want to look inside for parasites, anything abnormal. And again, bilaterally, that corpus cavernosum tissue, that kind of vascular tissue, was really prominent in both ears in this animal, and kind of darker on the right-hand side as well. You can see that there. All right, so what we've done here is we used a bone saw to remove the back of the skull. And so that pops off. You can see kind of how it would sit with a foramen magnum down here. And so we basically make a little trapezoid incision with the bone saw, and we can use basically a hammer and a mallet to kind of pop that off at the end. And so then what you can see here is essentially the caudal aspect of the brain. You can see the really large cerebellum here, as well as both hemispheres of the cerebrum. And so these guys actually have a really well-developed temporal lobe, kind of like the caudal-lateral aspect of the brain. So it can be really difficult to actually get the brain to come out of the cranium or the skull. So we've loosened the tissue, the dura mater around the brain, and the dura mater usually stays with the actual cranium or the skull. And so we've loosened that tissue a bit with just digitally around to kind of loosen all those connections. Caudal aspect there, brain, spinal cord's coming in, brainstem at the ventral aspect, cerebellum, cerebrum, and that's kind of what that looks like from an anterior section with the frontal lobes as well. And then you do want to examine the interior surface of the cranium as well. This looks fairly normal, but the surface is, just a little bit roughened, but doesn't appear thickened. The dura mater looks normal. And you can sample, it's a good place to sample the optic nerve as well, from in here where the chiasm happens. You can look for hemorrhage as well within this cranium. And then we'll just incise into the brain. We can look for hydrocephalus in these animals, so they can have increased amounts of CSF or cerebrospinal fluid. And so we'll just incise into the brain to see if that's the case with this animal. The meninges look fairly normal, honestly. Sometimes you can kind of see an inflammation within the meninges that makes them look thickened or a little bit more gelatinous or opaque. But honestly, this actually looks fairly normal. So we'll do just kind of a general transverse incision to look at the ventricles and to see if there's any indication of hydrocephalus, which you would see fluid kind of pouring out, and we don't. So you can see the lateral ventricles there, but the differentiation between the gray and the white matter, that actually looks fairly normal. We'll do a couple of incisions. So these animals can get parasitic tracts through their brain and an associated necrosis. So far, I haven't seen that in this animal yet. And then we'll incise into the cerebellum. Again, that all looks fairly normal. Brainstem down here as well. All right, well, less exciting than we anticipated being, but we can take some images of that as well. We did the necropsy of the adult male common dolphin today that stranded alive yesterday. And what we found really was more normal findings than we expected in this animal. So we found very few parasites throughout the lungs, just a few lungworms, very few parasites throughout the GI tract, which was also somewhat surprising. And so just a few 2 Brownina in the main stomach, and no other real parasites throughout the gastrointestinal tract. There was no evidence that this animal had been feeding recently, so that is an interesting finding. And then in terms of other parasites, we did see a moderate burden of monorrhigma, encysted monorrhigma within the abdominal cavity, as well as Philobothrium, which is another parasite encysted within the blubber, the caudal blubber of this animal. Those are pretty common findings for these guys. Externally, we did see the Xenobalanus, which is the species of barnacle that was just on the trailing edge of the flukes as well. So the most significant clinical finding in this animal was the sinusitis, or the abnormal kind of purulent discharge that we found in the pterygoid sinuses. There were also associated worms as well. And so really our main diagnosis from the gross necropsy was a verminous sinusitis. And we didn't see any other evidence of inflammation on the brain grossly, so we took a lot of samples for histopathology, and we'll know a little bit more once the pathologists get to look at this animal on the cellular level. But to be honest, not a ton on the gross necropsy level. And sometimes that happens, unfortunately, and it can take months, if not years, to put together a case. So we took a lot of samples for histopathology, for biotoxins, for contaminants, and we'll take all of those pieces together to try to put together the picture of what happened to this animal. He was in thin body condition, slightly thin body condition, and again, no evidence of recent feeding. So we do believe that there was something a little bit more chronic going on with him, but it was not evident grossly.
So one of the most important aspects of the necropsy is the data recording, and all of the marine mammal stranding work we do is the data collection process. And so that starts with the external exam, or actually starts with the live animal response and the life history, or the case history, as well as the external exam, and that includes your basic information, where the animal was located, the species, the length, the sex, the date, the latitude and longitude, and then continues on to more, depending on the types of exams that you're doing, more detailed information, in particular all of the data that you collect during the necropsy. And so the final report is sort of the main thing you have to go back to reference after the necropsy is complete. It's what you use as a basis of trying to determine the cause of death or cause of stranding of your animal, what you use to reference back for all of your photos that you've collected, as well as part of your larger documentation of the case, as well as what you reference back to with your lab analysis findings. So the data in the necropsy report, the final report, is really the most important aspect, and the photos then are added into that as well. And so it's really important to ensure you collect the data immediately while you're in the middle of the process and as accurately as possible. And one of the things we've instituted to do that is we directly enter our necropsy data into the electronic report to avoid any transcription, and also just speed up the process so you're not then having to go back after the necropsy and transcribe the information. And also prevents errors in spelling or typos or handwriting, and really helps ensure that you can get that report done immediately. So it's really important to fill out all aspects of your data sheets and your necropsy report, and note when you weren't able to examine things, or if you looked at them and they were normal. All of those aspects are very important, and it's important to write good, clear details about every aspect of what you're doing, and include as many notes. And it's important to get it down right away, otherwise you will forget and you'll lose that, potentially lose that information. At the end of every necropsy, it's important to go through all the gross findings for that particular case, and also loop that back or connect that back to the case history for the animal, and then try to determine if there are any differential diagnoses that would be important to note for this case, and complete that summary before the end of, basically before you've finished or completed your necropsy. You should complete that summary and complete your necropsy report. Another important aspect of the necropsy, which we've been doing throughout, kind of in the background, is sampling, of course, so that you can, we collect a very wide variety of samples from life history, including teeth for aging and skin for genetics, to a full suite of histology, so that we can, that's kind of one of our main tools for diagnostics, for determining kind of the initial sort of analysis we send out to determine or to corroborate what we saw with our gross findings, and kind of to determine that cause of death or cause of stranding. And so throughout we have a set of histology samples that we take on every case, at least fresh cases, or animals that are in good condition codes. And we take a key set of core samples for histology for every case, and then when we see gross findings or interesting findings in the necropsy, we'll sample additional organs or tissues as needed or as necessary. And in addition to the histology, we take complementary samples as well for infectious disease that will go frozen in a -80 or ultra cold freezer, and those will be saved for and archived for later. So if we do have findings of infectious disease on histology, then we can go back to those archives and send those particular tests out to determine what type of infectious disease may have caused the lesions that we saw, or our gross findings. In addition to the histology and the frozen samples, we also take contaminants, because marine mammals, like many other, and even humans, are impacted strongly by contaminants that we put out into the world, and particularly out into the ocean. And many marine mammals, or there have been many studies that have found contaminants such as PCBs or mercury, lead, and it's still found in some cases, but even DDT, which is no longer, or a lot of these chemicals are no longer used, but they're persistent in the ocean environment. And so they're still found even years later, and they can have impacts on these animals. They're less obvious, so it sometimes takes years to kind of piece those things together. But taking archival samples for those contaminants can be really beneficial in years to come. And additionally, we'll take samples for biotoxins. So when there's harmful algal bloom events, those can often then trigger, then can impact marine mammals with higher levels of biotoxins that are caused by those algal blooms. And so that's another thing, that we get a large number of unexplained deaths of marine mammals, and that can be one of the things that could potentially be causing it. And taking these archive samples, so we can then go back and then test them and rule that out, or see if that may have been a cause. As I mentioned before, we also take teeth mainly for aging, and skin mainly for genetics, but those samples can also be used for things like stable isotopes studies to kind of figure out where animals may have been feeding or what they may have been feeding on. And those are the kind of core samples. Additionally, we'll take parasite samples if we do find parasites like the Bronina we found today. That's something we would sample and then send out to a parasitologist as well. Other things that we might consider sampling would be, we might take cultures for microbiology. So again, for kind of on the infectious disease side, we're looking for growth of fungus or bacteria. We didn't see anything today that really kind of triggered that type of sampling. So over here, Kira is doing some of our sampling for us here. This is the pre-scapular lymph node that we just took the photograph of. And she'll be carefully sampling that for histology. The kind of key for histology samples is to really limit the handling of the sample, because if you crush it or handle it too much, you can damage the tissues because the histologist is looking at it at cellular level. So try to use sharp tools and take very small samples. We want to make sure the samples fix well. So we want to cut all the samples down so they're no thicker than 1 centimeter, so they fix in the formalin well and don't desiccate or basically rot or go bad within the sample bottle. And then that way we can get a clear picture of kind of, the pathologist can get a clear picture of what we saw. Other important components of sampling are good labeling. So it's really, really important to label each and every sample. We actually try to put 2 labels on every sample. So one on the outside that's protected, as well as an additional label on the inside. As if a sample doesn't have a label on it, it is no good to you. So we try to be very mindful about tracking all of the samples that we collect, labeling them very clearly, and then entering them into our sample database so we know exactly what samples we have collected and have available for each case. So one of the most important aspects of the necropsy is the documentation, and that includes data and data recording and photos. And so at the end of the necropsy, basically really all you have left is that documentation. So it's really important to ensure you document the entire process, from the case history of the animal to the live, including the live stranding event, as well as a very thorough external exam, and then documenting all of the organs and any potential lesions throughout the necropsy process as well. So we take, as you've been seeing through the necropsy, we take a lot of the photos in situ in the body, so we can see kind of the placement and how they look in relation to the rest of the organs. But additionally, we'll take organs out and photograph them on a cleaner surface so we can get a better look at them, particularly if organs have lesions or some sort of significant gross finding, then we want to be certain to take an additional photograph of that. And so things to keep in mind with photographs is making sure you get a clear, sharp image that is also has good lighting, so you can actually see the tissue or see the lesions well, and that can be tricky, particularly if you're doing necropsies outside. Additionally, it's great to have a clean background so you can see the tissue well and see the lesion and the coloration well. In every photograph, you should attempt to have, or try, every photograph you should have a scale and an ID that can relate that photo back to that case number as a very important component of the photographic process. And it's also important to, for organs that aren't obvious, to have a label within the photos so that you can recognize that photo, or take notes as to which frame numbers are for which organ or which lesions that you may have found. And so we'll just take a few examples here. So again, I'm just making sure the lighting is good, making sure everything's sharp and clear. It's also great to take a good squared off photo at a sort of 90-degree angle so that you can actually see the scales accurately, and so if you need to measure later on or get that reference, it's important to do. But sometimes you need different angles as well, so you can capture the lesions you may be looking at. So on this prescapular lymph node, you can see some of the dark reddened areas on the cut surface there, and that's what I want to focus on. And when you're looking at either external lesions or lesions on an organ, you also want to make sure that you take a wider frame shot so that you know what you're looking at, then zoom into the lesion or the area that you're looking at so you know where that is on that organ or on the body. And it's always important just to look at your photo and make sure that the image is sharp and that you captured what you need to capture and the lighting is good. And it can get challenging towards the end of the necropsy, but it is really important to try to keep a nice clean surface so that you get good quality photos even at the end of your necropsy.